Hi, I'm Dr. Chike. I'm an adult and child psychiatrist. I like to call myself a talking psychiatrist because not only can I do medications, but also therapy. And in fact, for most of my training, that's what I worked on was actually therapy with meds when necessary. And I'm very comfortable doing therapy with no meds as well. So one of the things I like to pride myself on is realizing that when somebody comes into the office, it's really, I'm there to help them with their life. Because I might have all these ideas about what I want in life, but really it's your life, and I'm trying to meet you where you're at with trying to make your life the best for you. And I want people to be happy and have fun, and that goes for the adolescents too. Oftentimes, kids will come in and they're not coming here a lot of times because they want to. It's usually a parent, and I tell them, "Wow, when you're here, your life's pretty tough, right?" And they say, "Yeah." I say, "Well, when your life is tough, my life is tough. When your life is easy, my life is easy." And they usually laugh because they look around and they can tell I like to enjoy life, and they believe me, and it's our our kind of our goals are in the same direction. So when you call me on the phone, I'll hear a little bit about your story and tell you how I might be of help. And then when you come in, you go into some more details about your story, and I tell you a little bit more how I think it might be of help, how the treatment might proceed, some of my thoughts of the things you might want to work on, medications that might work. Especially where on medication, if you decide that you want to go down that course, I actually provide in email exactly how you take the medications, kind of the range of the dosages, and also other possible medications we might consider. So you basically have access to the same notes as I do, because since I do work so transparently, it's all right there for you. And I think that's really helpful to patients. I've noticed over the years. The way I work is I try to be really respectful of people. It's no small thing to come into therapy. Nobody ever comes to therapy on their best day. It's often their worst, and I really try to keep that in mind. So what I do is I really try to meet people where they're at. As therapy progresses, and we wrap up the piece that you came in with, sometimes other things will come on that you might want to work on, and we discuss that, and sometimes people decide at that point to wrap up therapy. Yeah, because I really try to be of help and help people have get the most out of their lives.